I'm delighted to be introducing our first allied health professional strategy. This is such an important document and such a day to celebrate. When I first joined the organisation over 2 years ago, I can remember talking with Debbie Bray about how important it was that each of our professions across the organisation, but in Debbie's case allied health professions, had their own strategy, and here we are today launching it. I've been so impressed with the work that you and colleagues have done in order to bring this together, and for me it brings together a number of themes. Importantly, it sets out the ambition for allied health professions across the organisation. So what is it that as an AHP you're adding to the quality of care for those we serve? Importantly, it also sets out a message to people who might be considering joining us, and for me sends a very powerful indicator that AHPs are recognised across the whole organisation. The contribution is really well described and you make a difference every single day, so really important. The other thing that's really important and that you'll see in this film is the voice of people we serve. People who use our services every day and their loved ones. And of course they know from first-hand experience what's important and what a truly outstanding experience of care looks like. And there again, the strategy sets that ambition. In my view, a strategy is only as good as its contents. You can have a strategy that's beautiful and is full of lovely pictures, but unless it speaks to the people that we serve and those of us delivering services, it's never going to be more than a beautiful document. This strategy is so much more than that. So I commend it to you and I hope you enjoy the following film.
Allied health professionals are the third largest workforce in health and care in England and make up approximately 12% of the clinicians employed by the Trust. Each discipline within the family of allied health professionals is unique in their specialist knowledge and skill. All provide a range of interventions focused on the common goal of enhancing individuals' recovery and independence through rehabilitation, enablement and re-ablement.
The role of the occupational therapist in the service users recovery is to find out what people need to do, want to do and enjoy doing in order to promote recovery and to be able to get their lives back. As an allied health professional, I work very closely with the wider team. Our consultant on the ward is very pro allied health professionals. She's very involved in occupational therapy. She believes that what we do can make a big impact on the patients' lives and their recovery. In order to be able to deliver a service, we focus on what the patient wants to be able to do. So we look at interest checklists and we do so we can make sure that the care plans and the therapy program is really person-centred. We like to promote people to start looking at going home as soon as we can, so we look at the transition process.
I think the input of my occupational therapist was the making of my recovery, probably because of the patients she showed me. She came with me when I first started going out because I wasn't used to going out on my own. They didn't make me do anything I didn't want to and so felt completely in control. The OT respected who I was as a person. And that I was still able to make my own decisions. Those who cared for me initially tried to take everything away from me, probably out of kindness, but it was different with the OT. They listened to me, and that helped me to feel that I wasn't on my own, but had someone with me who understood me and some of what I was going through. Unlike my family, who were telling me to pull myself together. I think working with the occupational therapist helped me to re-find my confidence and faith in myself, which helped me to get my life back. They got me to think about the future and helped me to take steps. And one thing that really helped was knowing that there was someone there that I could phone if I ever needed help. Going out became easier. Going out became something that I looked forward to and that was different. And it helped to prove that I was getting better.
The role of the prosthetist is, simply put, to provide a prosthetic limb for the patient. So we would see the patient, we'd measure them, we'd examine them, we'd take a plaster model of the patient's stump from which we will then make a socket. We have technicians that then build the leg to the prescription that we've agreed is the most suitable for the patient, and we then fit that limb. And then we do an ongoing, continuous support and adjustments as they change, as their needs change, as their body changes, we adapt and make new limbs as appropriate. But our work is very much focused on the client as a person, a very holistic view. We really want to make the right leg that suits what they want to do. People don't come to us saying, oh, I just want to walk. Well, sometimes they do, but they don't mean that. It's about independence. I've had patients who've said, I want to walk my daughter down the aisle. And they're absolutely determined that that's what they want. They want to walk their daughter down the aisle. And therefore we can provide limbs and things so that they can achieve that aim, because it's important to them. Life is what's really important. Teamwork is absolutely vital in the job that we do. We work together with a multidisciplinary team to get the best for the patient. That includes the patient, it includes the patient's carers, it might even include the community. Enable to get the patient, to enable them to get back to their work, to go to school, to do whatever it is they do. It needs the whole team to be working well together.
I was born with my leg deformed below the knee downwards, so at 14 months old I was given my first prosthetic leg after having an amputation at 13 months old. So over the last 40 plus years of being a limb user, I've seen many changes in the technology of the limbs supplied by the NHS. They've enabled me to live a good, full quality of life. I went to college, went on to university, I've become a mum, I've been in employment, and I get to do all the activities that I like to do. Getting a waterproof leg was the leg that changed my life the most. I mean, I used to have to hop everywhere, to the poolside, to the beachside, and balance in the shower. So getting a waterproof limb meant I didn't have to do that anymore, and I was able to participate in open water swimming. And then I've got a functional leg. That means I can keep up with my kids, I can ride a bike, and I can go to the gym. And then my other leg is a cosmetic leg that's shaped like a leg, and I can wear heels because I can adjust the foot myself, and that's the one I call my party leg.
Vocational rehabilitation has fundamental principles and philosophies, and that is that work improves well-being and recovery. It gives people purpose, structure in their life, it improves their financial status, it gets them out engaging with people. Most people that do engage, sustain and gain employment end up being more independent and actually discharged from secondary mental health services. Vocational rehabilitation works from individual placement support principles. So we look at helping people to find and sustain competitive and meaningful employment in quite a short space of time. Some people might need to access training or courses to improve their knowledge and to get the job that they really want to get. Some people might want to do a few weeks work experience, so the team engages with employers to see if there is an opportunity there so they can trial certain roles and remits.
When I left hospital, I was in an acute setting, and then I carried on my recovery at home. But I was wondering what I was going to do next when I found the KMPT website and the job taster programme offered by the Vocational Rehabilitation team. The job taster coordinator was great. She listened to everything that I said, she understood what I'd been through. She offered me opportunities, and that was something that was really encouraging for me. And together we formulated a plan of where I could be placed, and I was put alongside an occupational therapist. And it was really this placement that inspired me to go on to become an occupational therapist myself. And through the work that I did at the placement, I then decided that actually that was the work that I wanted to do
I enrolled at university and I'm in my second year now at university studying to become an occupational therapist.
The role of a physiotherapy assistant is to assist the physiotherapists in the treatment and assessment of our patients. We would follow up on treatment plans provided by a physiotherapist, and that could include exercises, or it could be mobility practice, so that could be gait re-education or practice walking with walking aids. Physiotherapy can enable independence by basically the exercises that we can give, the support that we can give patients. We would sit down with a patient and try to understand not just physically but mentally as well. So physiotherapy helps people do things they believe that they won't be able to do.
Physiotherapy has been a process of hard work, learning to cope with everything and get back on my feet again. My physio has never doubted or questioned me and has helped me and my family understand my injuries and future treatments. I'm living with the trauma of my past, but my physio concentrates on my strengths, and I now know what I need to do to be more independent, and I'm confident I'll be able to get back home. And you see, that gives me a reason to do my exercises.
Our professional strategy, with its collective agreement across the allied health professions, identifies 3 key areas of impact that we are skilled and experienced to deliver. They are based on what we know works, what service users tell us they need from us, and reflect national and local drivers in terms of increasing self-management, enabling independence, increasing quality and improving flow through services. As allied health professionals, we are on a journey to amplify all that we have to offer and are reaching out to a wide audience to demonstrate our transformative outcomes. We are well placed to have a positive impact on key trust clinical priorities, and in doing so enable people to rebuild meaningful lives.
Well, I don't need to say much more, I don't think. Doesn't that just say it all? My allied health professional colleagues, you are at the heart of delivering outstanding services. You've just seen evidence of that. Take this strategy, run with it, be ambitious and be proud. Be #KMPT proud.